Premature rupture of the membranes. It is a rupture of the membranes before the onset of labor. And the two types are preterm, that's before 37 completed weeks, and term, that's after 37 weeks, but 1 hour or more before the onset of labor. The causes are cervical incompetence, genital tract infection, trauma. The symptoms are gush or leakage of copious fluid from the vagina. The signs that are usually elicited are smaller uterine size for the gestational age. Also, speculum examination reveals clear fluid from the cervical os or pool of fluid in the posterior vaginal fornix. And if complicated by infection, that's chorioamnionitis, a fever could be present and purulent vaginal discharge. Also, there could be fetal tachycardia and bradycardia and maternal tachycardia, uterine tenderness. Investigations are FBC, sterile speculum examination, including swab for culture, ultrasound scan if available for the gestational age, and fetal lie and presentation, amniotic fluid volume, normal or reduced, and the placental site. Also estimates the fetal weight. Urinalysis and culture is done. So the main treatment objectives are to prevent or treat infection, to prevent labor if preterm and baby is very mature, also to improve fetal survival through improved fetal lung maturity. Non-pharmacological treatment. Bed rest is recommended. For pharmacological treatment, infection prevention, you give amoxicillin oral 500 milligrams 8 hourly for 7 days. That's first line treatment. And also you add metronidazole oral. So metronidazole oral 400 milligrams 8 hourly for 7 days. Second line treatment, you give amoxicillin clavulanic acid oral 625 milligrams to 1 gram 12 hourly for 7 days. Infection prevention, that's patients with penicillin allergy, you give erythromycin oral 500 milligrams 6 hourly for 7 days, and metronidazole oral 400 milligrams 8 hourly for 7 days. Or fetal lung maturation, as for babies 28 to 34 weeks, you give betamethasone oral 0.6 to 7 milligrams every 24 hours. That's 2 doses, or dexamethasone oral 6 milligrams 12 hourly for 4 doses. The treatment is most effective if delivery occurs at least 24 hours after the first dose of the medicine has been given, and less than 7 days after the last dose of the medicine. They also benefit the premature newborn by lowering the risk of intraventricular hemorrhage and death. Referral criteria: if at sub-district level, we refer patients to the hospital or specialist for further management. If the signs of maternal infection are present, also pregnancy is less than 37 weeks, or premature labor occurs,